Hello and good evening. This is Dr. Chetna once again with a new topic. Today we are going to talk on endometriosis and pregnancy. So, once again, I repeat my topic. Today we are going to talk on endometriosis and pregnancy. So, why endometriosis is important? What is endometriosis? How it affects fertility and how it impacts your pregnancy. So, all this is very important for you to understand. Now, endometriosis is a condition in which the lining of the uterus, which normally is shed through the menstrual cycle, through the vaginal passage onto the outside, sometimes travel through the fallopian tube and into the uterine wall and causes a disease which is known as endometriosis. This can occur in the uterus itself, the fallopian tubes, ovaries, and the surrounding pelvic tissue. This tissue is very inflammatory and leads to a lot of reaction and leads to change anatomy of the tube, ovaries, pelvis, and other organs. Now, what it can cause? It can cause heavy periods, painful intercourse, constipation, diarrhea, and also very, very heavy periods. A lot of women can have difficulty in conceiving. Now, if I want to address about 30% of the women over the age of 30 are likely to have endometriosis. Then the women who are trying to conceive, if a couple is trying to conceive, they have about 15 to 20% chance of getting pregnant in the same cycle. With endometriosis, the chances reduces to between 2 and 10%, which is less than half of the normal people. So that means a lot of women with endometriosis would be having low fertility and would need treatment and possibly medical aid before they conceive. So, how does it impact? So, it can alter the tubal anatomy, it can alter the tubal function, it can prevent the eggs from getting released from the ovaries, and also it can affect the internal milieu of the uterus, and thereby it prevents implantation of a fertilized egg, or which we call an embryo. So all these are very, very real. Now, what you can do to prevent it? Endometriosis is a genetic condition and it never is seen before the age of 18. Very rarely it could be seen in younger women. But typically, this is an age, or it starts from around 25 and it peaks at around 35. A lot of women with endometriosis will present with pain, heavy periods, difficulty in conceiving. The diagnosis either can be made on ultrasound if the endometriosis is affecting the ovaries or the uterus, but in majority of the cases would need a laparoscopy to confirm if it is not doing so. However, once a diagnosis is established, we need to know what is the fertility plan of the couple, and if they intend to delay it for infinite times and reasons, then they should be counseled that probably that's not the right thing to do. In spite of this, if they want to defer their fertility plans, that would be their wish. But in that scenario, it would be advisable to freeze their embryos because what you attain at a younger age is of better quality. However, an endometriosis will still keep on damaging the uterus for the time till the woman reaches menopause. And at menopause, this disease gets arrested. Now, by menopause, a lot of women will have frozen pelvis, and it becomes almost difficult. They remain, in spite of menopause, they may still be having pain. And the best advice for such a severe endometriosis is to complete their family as soon as possible. Now, what could be the impact of pregnancy on endometriosis? Endometriosis can impact the pregnancy in three ways. Either it can improve the symptoms, then it could not do anything and just stay the disease as it is, or it can worsen the symptoms. So let's try and understand how it can improve the symptoms. Endometriosis is a disease which is fed by estrogen. During pregnancy, there's a very high content of progesterone. And once the content of the progesterone is very high, then it leads to some correction of endometriotic deposit. So about one third of women will probably report less symptoms post delivery, and they say this is a significant improvement ever since they have delivered because a lot of lesions would heal with such large doses of progesterone delivered during pregnancy to those endometriotic lesions. About a third women will have no improvement of the symptoms, and these are the women where the estrogen and the progesterone were working probably equally, and it did not matter to them. However, a small percentage of women might actually see a deterioration of symptoms. So these are the women wherein the ovary, the tubes were stuck, they are fixed anatomically. As the uterus tends to grow with baby, the tubes and ovaries, they also tend to grow, they get stretched up along with the uterus. Now, if they are stuck in the pelvis, then the ligaments are badly stretched. So there'll be a lot of radiating pain and nervous pain in the lower abdomen. Now, it is very difficult to control that pain, and very basic painkillers like paracetamol alone can be given. The good thing is majority of the women do not complain of such pain, and the pregnancy goes on smoothly. If some of these women are having a cesarean delivery, a little bit of correction can be done at cesarean. But majority of the women who have a normal delivery, they will remain so post delivery. So it is very important to address the disease on time and treat it. Now, what do you do if you think you have endometriosis? Women who have not been sexually active and who are very young and they have endometriosis, there are various medical choices. Oral contraceptive pills is the simplest choice that one can take, and that will arrest the growth of endometriosis to a certain extent. If somebody is very badly diseased, then there are certain hormones which can create menopause, and they can be given for a short interval to alleviate the pain and correct the disease. Thereby, they can be shifted to other medications. There are certain anti-endometrial drugs which can be used otherwise, but majority of these drugs will interfere with conception and will delay the conception if the woman is trying for a fertility thing. There is a new drug available which is also a dopamine antagonist, and this medicine can also be used for during while the woman is trying to get pregnant. So that means during the fertility plans it can be used. However, the best advice for women who have endometriosis would be to plan at least one baby in time so that they don't have major suffering. And once the family is complete, or the spacing between the two babies is best done with an intrauterine device which delivers the progesterone in the uterine wall, thereby reduces the amount of the uterine lining, which is endometrium, formed every month. And once the endometrium, which is formed every month, is less in quantity or almost negligible, the chances of the disease increasing further is quite, is quite less. So, sorry, I lost the signal. Sorry. Okay. So it's very important for the woman to identify and address the disease early and not to delay the diagnosis and the treatment infinitely. So any questions related to this, we are welcome, and I mean we welcome those questions, and I'm willing to take those. And even if they are unrelated questions, I'm okay with them as far as they're related to obstetrics and gynecology. So I can see a question popping on my screen here. So what are the do's and don'ts for endometriosis? Well, the do's of endometriosis is first you have to identify what is your disease, speak to the treating doctor, find out what is your age and when you should be conceiving, what is your current fertility status, how bad or good is the disease, and you should put yourself on the best medication tailored to your needs. So the medications which are available could be Mirena or pills or the menopause creating drugs. So depending on your situation, but certainly you should be taking the drug, but medicine or some kind of treatment. But in case you do not wish to, then you will have to do a very close monitoring and possibly plan a baby if when you are still in your 20s and not in your 30s. How does endometriosis affect pregnancy? So endometriosis can lead to miscarriages. It can lead to preterm labor. It can lead to difficulty in conceiving. And people with endometriosis are likely to develop little more blood pressure compared to the rest of the population. But for the majority, the pregnancy continues unevenful. If I talk, when it comes to a normal population, the pregnancy loss rate is about 22%, while in endometriotic patients, the pregnancy loss rate is about 35%. So you can understand the difference between the nature and the patient people with disease. So I believe this answers the question. How can I get pregnant with endometriosis? Yes, this is a very good question. The thing is, endometriosis could be mild, moderate, or severe. There's American Society Fertility Classification, based on which we decide. Now, what is very strange is people with mild endometriosis could have difficulty conceiving, while people with very severe endometriosis who have no symptoms and they can conceive very easily. So, first of all, it is important to know that if you have endometriosis, still you should try to get conceived in a very natural way, provided your tubes are open, your ovaries is releasing the eggs, your uterus is of reasonable quality, and you have good anti-malarial hormone. So in this scenario, you all understand about the fertile period. If not, then probably you need a medical care to test your hormones, do a follicular study, and plan the right way. And if you are having difficulty and you don't conceive in 6 months' time, it's best to see a doctor. Can endometriosis cause miscarriage? So I think we just spoke. Yes, it can cause the pregnancy loss. But once the woman completes 12 weeks, the chances of pregnancy loss is very less. So by 12 weeks, about one third of the endometriotic women would have lost their babies. However, the rest will continue. Thank you for joining today's webinar. We'll be back again next week with another topic. If you have any interest, do write to us at janchetna@gmail.com, or you can ping us on this number, which are coming and running on your screen. Thanks indeed. Bye-bye.